Functional neurological disorder (FND), also known as functional movement disorder or conversion disorder, is a condition characterized by neurological symptoms that are not explained by traditional neurological or medical tests. These symptoms are real and can significantly impact a person's daily life, but they arise due to a disruption in how the brain processes and controls bodily functions rather than from structural damage or disease. Symptoms: the symptoms of FND can vary widely and may include motor symptoms, tremors, involuntary shaking or trembling, abnormal gait, difficulty walking or unsteady movements, weakness or paralysis, involuntary loss of muscle strength or function, dystonia, abnormal muscle contractions causing twisting or repetitive movements, sensory symptoms, numbness or tingling, unexplained sensations or loss of feeling, pain, neuropathic pain without a clear physical cause, seizures, functional seizures, seizure-like episodes without the electrical disruptions seen in epileptic seizures, speech and swallowing difficulties, speech problems, difficulties with speaking clearly or consistently, swallowing issues, problems with swallowing food or liquids. Other symptoms: fatigue, persistent tiredness that does not improve with rest, cognitive issues, problems with concentration and memory, often referred to as functional cognitive disorder. Causes and risk factors: the exact cause of FND is not fully understood, but it is believed to involve a complex interaction between biological, psychological, and social factors. Psychological factors: stress, trauma, or emotional conflict may contribute to the development of FND. It is thought that these factors can affect how the brain processes and responds to bodily symptoms. Biological factors: abnormalities in brain function, such as disrupted neural pathways or changes in brain activity, might play a role. Precipitating events: physical injury, illness, or significant life events can sometimes trigger the onset of FND. Genetic and environmental factors: some research suggests that genetic predisposition and environmental factors may also influence the likelihood of developing FND. Diagnosis: diagnosing FND involves medical history and symptom review, detailed information about the onset, progression, and nature of symptoms, physical and neurological examination, assessment of symptoms to rule out other neurological or medical conditions, diagnostic tests, neuroimaging e.g., MRI, CT scans to exclude structural brain abnormalities, electroencephalogram EEG to rule out epilepsy or other seizure disorders, laboratory tests to check for underlying medical conditions, referral to specialists. A neurologist or psychiatrist may be involved in the diagnosis and management of FND. Treatment: managing FND often involves a multidisciplinary approach. Psychological therapy, cognitive behavioral therapy (CBT) helps address underlying psychological issues and develop coping strategies. Psychotherapy may assist in dealing with trauma or stressors related to the symptoms. Physical therapy, rehabilitation, focuses on improving motor function, strength, and coordination. Movement training, techniques to address abnormal movement patterns and improve daily functioning. Medication, pain management, medications may be used to manage associated pain. Antidepressants or anxiolytics, in some cases, medications for underlying anxiety or depression may be prescribed. Education and support. Patient education, understanding the nature of the disorder and how to manage symptoms effectively. Support groups, connecting with others who have FND for mutual support and advice. Coordination of care. Team approach, involvement of various healthcare professionals, including neurologists, psychologists, physiotherapists, and occupational therapists. Prognosis: varied outcomes. The prognosis for individuals with FND can vary. Some people experience significant improvement with appropriate treatment, while others may have persistent symptoms. Early intervention, Early diagnosis and treatment can improve the chances of recovery and help manage symptoms more effectively. Conclusion: functional neurological disorder is a complex condition where neurological symptoms arise without clear structural abnormalities. It involves a combination of physical, psychological, and social factors. Diagnosis and treatment require a comprehensive approach involving medical, psychological, and therapeutic interventions. If you're someone who knows experiencing symptoms that might suggest FND, seeking evaluation from a healthcare professional is crucial for proper diagnosis and management.